Hello, hello, hello. Good morning. Another Saturday is here with us on the Health and Wellness Hub right here on Sienna Media TV. On YouTube, we're showing live on YouTube and on Facebook. Welcome to this segment this morning in May. We're live, so please share the link, subscribe to our channel, and call your friends, your family, your loved ones to come and listen to free healthcare advice. All right, so you all are welcome. My name is Ms. Del, your usual host, and today I have three beautiful ladies who are going to join in all the way from Maryland to educate us on colorectal cancer and also talk about their organization. So please call your friends and everybody to come in. Tell them we are live so they can join us. So we're just going to play a brief interlude and then I'll come back and introduce my guests for today. All right, stay tuned. Welcome back. Welcome back. This is the Health and Wellness Hub show on the Sienna Media. We are live on YouTube and Facebook. So we welcome you all this morning. As I said earlier I'm the usual host. My name is Miss Dale. And today I have three beautiful ladies here with me, all the way from Maryland, who are going to talk to us about colorectal cancer and also talk about their lovely organization. Okay, so I'm going to go straight to introduce my lovely ladies in the studios today. My special guests all the way from Maryland. They are from the Maryland Association of Ghanaian Nurse Practitioners. Wow, beautiful. Ladies, you're welcome to the Health and Wellness Hub.
Thank you.
All right. Okay, so I have with me here Dr. Agnes Mensah. She's that's a lot of credentials. So I'm not going to go through all the credentials, but she has over 20 years of experience in healthcare. She has experience in CV, ICU, IMCU, med-surg, psychiatric. She's also an academia. Okay, and she has worked in acute psychotic unit and also a day clinic for the past 5 years. Okay, so then next is Dr. Joyce Opombediako. She's a dedicated healthcare provider with over 25 years of experience. Wow. And she's committed to providing holistic care, teaching in various universities, and um, she loves her students. Yes. She also has led various medical projects and provided care under various specialties. Dr. Joyce Upon has won multiple directors award for her innovative approach from bedside to the classroom. All right. She also has a dual certification as primary care provider and a psychiatric mental health nurse practitioner. All right, that's a lot. In 2025, she was selected to Liberia as a lead provider for innovation and teaching as in Ebola vaccination. She was awarded as a director for the best provider of NIH in 2020. And she is an adjunct faculty at Warden and Georgetown University nursing program. Wow. 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 Awesome. Now I'll move on to Dr. Dosia Owusu. She also has over 20 years of experience in healthcare and with diverse clinical background that includes gerontology, cardiac care, youth psychiatry, and she's currently operating a psychiatric private clinic. Wow, awesome, ladies. I'm very proud to be talking to you this morning. You are welcome again. Okay.
Thank you.
So we'll go straight to Dr. Agnes, who's going to talk to us about their organization. They all belong to the Maryland Association of Ghanaian Nurse Practitioners. So please talk to us about the organization.
Thank you for this opportunity. We really appreciate it. So the Maryland Alliance for Ghanaian Nurse Practitioners is our vision and our mission is committed in enhancing the healthcare delivery in both the United States and the Ghanaian community here and back home. So our goal is to network with the nurse practitioners here, and also as time goes on to network with nurse practitioners back home as well. The vision is to advance education, promote resources, sharing, expand sustainable healthcare initiatives that will improve access to quality healthcare here in the United States and also in Ghana. Also, the vision and the mission is also to help new nurse practitioners, the ones who are yet to start the program, in terms of precepting, also educating the Ghanaian community, like going to churches, community activities, educating them about other healthcare issues. We have psychiatric nurse practitioners, as you know. Then we have also acute care nurse practitioners, midwives in this organization. So with our experience, we go into the community, we educate our community, especially here in the United States, in terms of, promoting healthy living, other diagnosis that is going on in the Ghanaian community. So that is more of our, it's more of our vision and the mission of this organization.
Awesome, awesome. I can see you are doing an awesome job right there
Thank you.
in Maryland. So is this just limited to your like your city?
Not really in the city. So the initiative was because they have other nurse practitioners organizations in other states.
Yes.
So the initiative was to start in Maryland, and as time goes on, we will expand our horizon into other states. So that
Okay.
is the goal right now. But as of now, it's only in Maryland.
Wow, this
Yeah.
is beautiful. This is beautiful. And we want to thank you all for the good work that you are doing in our
Thank you.
community. We really appreciate it. And we know we all need this. We need to hold each other's, and then we all rise together, especially as women,
Yes.
So thank you all for what you're doing.
Thank you.
Okay. So I'll move straight to our next is Dr. Joyce Opom Bediakon, who is also going to talk to us about colorectal cancer. Over to you, Doc.
Thank you so much, Mitchell, for giving us this
Mute, yeah.
opportunity, this platform to be able to educate the public.
Okay.
I will give a little bit overview of cancer. There a little bit about me. You've already mentioned that. So let's go straight to the education part.
Okay.
These are my colleagues that we are working with. You've already mentioned their names. Dr. Dulcia and Dr. Mensah with me. So somebody will ask, what is cancer and why is it important to know? So the purpose of this presentation is to educate the public about colon cancer prevention. And cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. Cancer can start almost everywhere in the human body. Sometimes this chronological process breaks down and abnormal or damaged cells grow and multiply when they shouldn't. These cells may form tumors, which are lumps or tissues. Tumors can be cancerous or not cancerous, which is called benign. There are different types of cancers, which I will go over a little bit, just a little bit of it, because I don't want to lose your audience. So we have different types of cancer. We have breast cancer. Breast cancer is the kind of cancer that begins as a growth of the cell in the breast. We know it has affected millions of women. Some has been able to survive and some did not survive. The other cancer that we will just touch base just to let the public know that it is there and we need to look out for is bladder cancer. Bladder cancer also begins in the bladder. Now we know the bladder is a hollow muscular organ in the lower abdomen. So where we store our urines. So that is also another form of cancer that is out there that the population also needs to be aware of it. We have a kidney cancer. Kidney cancer grows, the cells start growing in the kidney. We have two shapes of kidney, and it can be affected both or one of the other, depending on how your abnormal cells grows. Then we have the endometrial, that is more of women, is the cancer that also grows in the uterus or the womb, as many people knows it. And then, of course, we have the colon cancer, which I am going to allow my colleague, Dr. Dulcia, to go over it. So I just want to say a little bit about when you are diagnosed with cancer. Let's say you have the symptoms and you went to see your doctor, they did the x-ray, they did the biopsy, they did the MRI, and it's confirmed. When this happens, they go through something that is called staging. And the important thing for the public to understand is, depending on how your stage is either your survivor or your treatable. So the staging is the process of determining how much the cancer has spread within the body. And when we talk about staging, so I don't lose your audience, we have 4 stages. It will be just minimally that I will touch base. And if, unfortunately, If you are diagnosed with cancer, this is a staging that you and your provider and your team, the oncology team and all the team will go through to explain to you extensively for you to understand and to be able to make informed decision. So we have the 4 stages. We have the 0 stages, which is non-invasive. That is when they have detected either in the blood. Mostly it's detected in the blood. And then when they do the biopsy, when the biopsy confirms it, it can be treated, by doing a minor surgery, even through a colonoscopy. Then we have the stage 1. The stage 1 is minimally invasive. It's localized. It has not spread yet. So when you're on stage 1, your chances of living is very high. The stage 1 is always treatable by removal, which is surgery. They remove it, then you go through radiation and then also chemotherapy when you have decided to consent to those treatments. Then we have the stage 2. That is the cancer that is a little more deeper. It's invasive. It has spread, but it hasn't gotten into the lymph nodes yet. That is when they say you're on stage 2. That is also treatable by surgery, chemotherapy, and the radiation. Then we have the stage 3, which has spread to the lymph nodes. Has spread to the lymph nodes, and that is when we call it mets. It has mets to other parts of the body. At this time, your oncology and your team will also let you know what treatment options you have, depending on the text that they will run, and they see the stages. And if it's something that they have to do surgery, they will inform you. They will give you your options, and then you're going to weigh your risks and your benefits. And then you decide that if you want to do surgery, if you want to get it treated, they'll go ahead. The stage 4, it has spread it to other organs. At this stage also, it's very difficult. Some people survive it, but most of the time it becomes a terminally ill disease. So these are just the little superficial definition of the stages. Like I said, unfortunately, we don't want anybody to get into the staging part, because we are going to educate you. It's going to be preventable. You are not going to be diagnosed with cancer, and then the staging comes in. But if, unfortunately, on the other side, the coin can go to either side. If the coin turn on the other side and you are diagnosed, this is the initial treatment staging that your provider, your oncology, your team will process you through to understand and be able to make informed decision. So this is just the superficial part that I will be able to let the public know the importance of preventing it. So this slide only talks about on the mental health, the problems that comes with if you are diagnosed with mental health. Of course, you're going to go through stress, which is a lot of stress, depression, all the information that you have to digest and to make executive decision. You also go to societal change, cancer in being being a terminally ill disease. It deforms a person's personality, and then it really, really demoralizes your being able to face the world, being able to face society. The emotional burden of finances is also there. And for this being said, our goal today is to educate the public to know that these type of diseases, these type of cancers are out there, but it is preventable. It is preventable. And at this juncture, I will give the mic to my colleague, Dr. Dosia, to dive into the colorectal cancer and how we can be best informed and be best to prevent it. Thank you so much.
Over to you, Dr. Dosia. So as we're waiting on Dr. Dosia, viewers, you are welcome. Please share the link and invite your friends and loved ones to come and listen to this free medical advice, because we know even booking consultation with our healthcare professionals is not free. But over here, you get it for free. So please, please, please share the link, subscribe to our channel, and invite everybody to come listen to life-changing how do you call it? Advice, because you never know who the life that you'll be saving. All right. So over to you, Dr. Dosia. You're muted. There you go.
Okay. Thank you very much. Give me 1 second.
Okay. Okay. So we'll play. Whilst we're waiting on Dr. Dosia, I'll just play music for just some few minutes as we wait on her to set up. Okay. I'll get her, technical difficulties. So we'll just listen to some music. All right. Okay, so while we're waiting on Dr. Dosia to come share with us, I'm just going to go over the various programs that we have here on this media. On Fridays, DJ Mawanyega comes away with African jazz and traditional music panorama every Friday, 8 p.m. Eastern Standard Time or 7 p.m. Central Standard Time. So this is for your Friday realization. Believe me, some good music. If you want to listen to some very good African and jazz music, please tune into this channel every Friday evening and you will thank us. Okay, so that is for Friday evenings. And then Saturday mornings, we are here with the Health and Wellness Hub. We're here. We bring medical professionals on here to come talk to us, to come advise us on what to do concerning our health. Okay. And then after that, we go to Empress Maushi and Afo Steve also come away with Sienna Central. Everything that goes on about Sienna, the upcoming convention, everything about Sienna, the projects that we're embarking on back home, they come here and then they talk to us about everything concerning Sienna and our people back home. And then after that, all the way from Ghana, Mama MFA comes away with Junenyo Bobo Show in collaboration with Top Radio. Yes. And they also treat various topics concerning us back home. All right. And then later on in the evening comes Dr. Dogbe, Dr. Wonyo, and their team also come on here to teach us our Ewe language. It's a rich language, and those of us, especially for those of us in the diaspora, we need to teach our children how to speak our language, about our culture. So this is the avenue. So please make sure to tune in later on this afternoon so we can keep learning our rich language. And then that'll be it for Saturday. And then Sunday, our sister Nicole comes our way with Afrikutu. Yes, she also come on here with a lot of our traditional men and women back home who come on here to educate us about our culture and our faith, as Africans. So these are the programs that we have on here on this channel for our weekend. That's for Friday, Saturday, and Sunday. So please tune in, subscribe to our channel, okay? Help us to reach the masses, help us to reach everybody you think will benefit from all these programs that we are bringing your way. And please help us subscribe and also do what? Listen to us when we are online, watch us. Okay, all right. So thank you. I think at this moment, Dr. Dosia is ready. So I'll just go back and bring Dr. Dosia online to
Okay.
continue. Welcome back.
Yeah. Thank you for the
You're
opportunity.
welcome.
And I'm sorry,
That's fine. We understand technical
technical
difficulty.
thing going on.
It
I
happens.
am happy to speak about colorectal cancer. But before we go on, let us try to figure out where colorectal cancer is. Colon is the same as the large intestines. And what does it do? It absorbs water from food material. And in there, feces are formed. And the lower part of the colon is the rectum. After the water absorption, the feces are pushed down to the rectum for storage until when we feel like using the bathroom, then it is eliminated. So the colon is the last section of the digestive tract, and that is the large intestines. So the cancer could be in the rectum or it can be in the colon. So that is why we have colon rectum cancer and shortened as colorectal cancer. Let's get a little statistics about colorectal cancer. According to SEER, Surveillance Epidemiology and End Results Program of National Cancer Institute, colorectal cancer is the most common cancer in the US and is the fourth leading cause of cancer-related death in the US. Let's check the surviving rates. Over all ages combined, about 65% of people survive at least 5 years after diagnosis. Now, the genesis of colorectal cancer. As one ages, we happen to get polyps in the inner lining of the colon. And polyps are abnormal growth that comes or that emerge in the inner lining of the colon. And a better picture of colon could be water hose or chicken intestines in a very big size. It's tubular and allows feces to pass through. So when these polyps appear with age and also DNA mutations, these polyps will be there, and with time, it can transform into cancerous polyps. Initially, when the polyps appear, it's benign or it is non-cancerous. But with time, with years, these polyps can just turn or degenerate to become cancerous and may invade deeper layers of the colon and potentially spread to other parts of the body. And like I said, polyps may appear due to advanced age, DNA mutation, which are related to exposure to carcinogens, chemicals over time, and which may contribute to development of diseases such as colorectal cancer. What are the warning signs of colorectal cancer? You can have blood in the stool or in the toilet. You can have bright or darkened blood in the stool. Why? The tumor bleeds into the colon. Second, as the feces rubs on the surface of the tumors, it causes some eruptions, and that also causes bleeding. So somebody may have blood in the stool. It could be something different, and it could be as well as what due to colorectal cancer. One thing also we can see is we can have change in bowel habits. We can have diarrhea. We can have constipation. We can have narrowing of our stool. When you are passing down your feces, you can see that it's coming like pencil-like. It tells you there's an obstruction in the way of the colon. That is why the poops is designed that way and coming out. And sometimes too, the obstruction growing as a tumor also just disrupts the activity of the colon. And as such, the poops can come as it should be, and we can have constipation. Another warning sign is persistent abdominal discomfort. Because the lane of the tumor is disrupted, the normal activities don't happen, and there is a disorder. The tumor itself can also be painful. So with this, we have that persistent abdominal discomfort. Sometimes too, you feel bulky. You feel like you want to use the bathroom. You go, you have finished, still, you feel like there is something still in the stomach, in the rectum that you must push out. The tumors in the rectum block complete process of eliminating the poops or the feces, and can cause local inflammation as well, which also gives pressure. So all these make us have that feeling of incomplete evacuation. Weakness or fatigue is another one. When tumors are feeding on the blood system in the colon, you are beginning to lose blood, and that can lead to anemia. And with that, you easily get tired. The bowel habits changes as well. And as this disruption in your colon is going on, people may not have good appetite. The obstruction is a whole disorganization in the colon. So this can make you not even eat well. And this can reduce intake, and thereby weakness can come. There are other obvious signs like iron deficiency and also nausea and vomiting, which also normally come at a later stage. Somebody can also have food poisoning and be throwing up and be having some other stuff. That means that there are other things that can cause similar symptoms or warning signs. So the ideal thing is to talk to your provider or your doctor when you have these symptoms showing. How do we screen for colorectal cancer? What is the purpose of screening for colorectal cancer? We screen to be able to detect cancer or the colorectal cancer on time. There are about a lot of ways we use in detecting this colon cancer. Normally, we have the stool-based test that we do at home, where you take, sometimes it gives you instruction, it's a pack. You just do it, you put it in a mail, and you send to the lab, and they investigate. They are just trying to find out if there is a hidden blood in your stool. If there is a hidden blood in your stool, that means it is due for investigation to find out what is going on with you. Other type is called guaiac and stool DNA test. All these things are done yearly, and the Cologuard could be 3 years. The purpose of these ones are just to detect blood in the stool, because a typical person with a colorectal cancer with tumors in the colon will have bleeding going on. Another way is imaging test, and this is minimally invasive. They can use CT colonography, they can use CT scan, and all the CTs and the scans. It's a precise way of finding out where and how the colorectal cancer has developed to. The last means of diagnosing is colonoscopy, and that is the subject of our discussion centrally today. Colonoscopy. I would say that colonoscopy is the gold standard for screening for colorectal cancer. According to the American Cancer Society guidelines and the US Preventive Service Task Force guidelines, when a person is at age 45, you must have a colonoscopy. So if you are here and you are above 45 and you have been doing only the stool-based test, talk to your doctor so that we can check on your colon to see if there are any polyps popping up. And if you already done that and it's past 10 years, you should also try and see your doctor, talk about it, and then you do it. Who are those who are at risk for colorectal cancer? People with family members who have been diagnosed with colorectal cancer. For example, your sibling, your parents, your children. Such people are, but according to research, are at more risk to developing or having colorectal cancer. People also who have a history of polyps in their system, like in their colon, or somebody who has ever had it before and it's gone. You also need to be a person who should be doing colonoscopy every 3 to 5 years. People with inflammatory bowel disease like ulcerative colitis and Crohn's disease, these people, by the nature of these diseases, the inner lining of the colon is constantly subjected to inflammation. And this lining of the colon becomes so vulnerable to developing cancer because of this inflammation process that goes on every day as a main symptom of this type of diseases. There are people also with genetic syndrome, a group of features caused by inherited or spontaneous mutation in the DNA, like Lynch syndrome. People of that group also are also at high risk, and they should be able to be talking to their doctors or the primary care physician to be able to be on top of that, know when to be able to do your colonoscopy. Okay, so briefly, let me also touch on what goes on with the colonoscopy. Sometimes people are afraid about it. People say they are afraid it will be. When you have an anxiety, you basically have fear about something you think you can't control. There are many people who have passed 45, 50, 55. They haven't done even a single colonoscopy. Remember, about 99% of colorectal cancer comes from polyps. And these polyps could be removed before it gets out of way. And by that, you have prevented cancer, being colorectal cancer. During colonoscopy, they are screening to detect cancer as early as possible. And when they detect polyps in the colon, they remove it during the colonoscopy. Okay, what is the process of having colonoscopy? One, you are prepped a day or two before the procedure. You are given a laxative to clear your system, and maybe you'll be put on a clear liquid diet so that when they go inside your system, there wouldn't be any obstruction, and they will have a clear view of the area of the colon. After the prep, you go for the procedure. You are asked to lie on the side of your, on your side, or any side of your body, and they also sedate you a little bit. So sometimes you don't even know what is going on. And what they do is they use a flexible tube with a camera, powerful camera, to go through your anus, get inserted into the colon to visualize what is in the colon. And by that, they are able to see if there are any polyps. Then they remove it. These polyps are non-cancerous. If they are removed early, is the best. And if they happen to see any polyps or anything strange over there, they will take tissue samples to the lab for investigation. And after the procedure, right there, you are giving your findings. And after the procedure, you have to spend about 30 to 60 minutes for rest. And you always feel a little sedated, and you may have to go home with somebody driving you. There is little pain. It's actually it's pressure and discomfort. There is no pain with that. And it's a walk-in, it's a same day kind of procedure. So there isn't any much fear like people anticipate. And somebody told me, if I do any procedure, I don't mind, but it's the listening of the results. That is the big thing there. But let's look at it. The polyps are non-cancerous. So if you remove it, you have prevented cancer. Not all polyps tend to be cancerous, but who knows whose polyps will be cancerous. So if you go and remove it, it's better than saying that, oh, I'm afraid, I don't want to go through this. They will put something through my anus. I don't want to do this. It's not stressful as you may think. So if you are here and you are that age, please take advantage of the system and go and check that, than envisaging you being so sick on a bed. Doing colonoscopy prevents polyps from turning into cancer. Okay, so now I want to touch on factors or exposures that increase the likelihood of getting colorectal cancer. We have modifiable factors and we have non-modifiable factors. The non-modifiable factors are such as, I would say, age. With increase of age, after 45 years, most cases of colorectal cancer is above that age. I'm not saying that colorectal cancer cannot happen with younger children. Even research shows that these days, the rates in young people are coming up. So at age 45 and above, you are prone to have these polyps in your colon. So age is a risk now. Personal history. People with prior polyps, like I said earlier on, they also stand a higher chance of getting the polyps in their system. And family history, and also the genetic syndrome, the inflammation bowel diseases. These factors are some factors we can't do anything about. But for the modifiable factors, we have diets. Research shows that high intake of red meats and processed meats end up giving the body some carcinogens. So we have to limit the intake of that meat, those kinds of meats, and even charred meats, black meats. People will burn and cook on high heats and make sure their meats are well cooked on high heats and get dark or burn. This also produces some chemicals that also can be a carcinogen for cancer to happen. Alcohol use. Alcohol leaves us with a byproduct. That is also a carcinogen that can also influence the happening of what? Colorectal cancer. Tobacco smoke contains multiple carcinogens that affects the colon. How do we prevent colorectal cancer? So we have to do diet modification. We have to limit our red meats and processed meats. We have to even do regular exercises, because as you do regular exercises, your bowel move easily. And the waste products that may have chemicals doesn't stay long in the lining of your colon. You have to know your family history. and any conditions that is prone to becoming making you develop colorectal cancer. At this point, I'm going to end by saying that screening saves life. Colonoscopy is the gold standard for screening for colorectal cancer. Colon cancer develops slowly, but mostly from polyps. Colorectal cancer is preventable, is detectable, and treatable. So please take charge of your life. Thank you for your audience.
Wow, wow, wow. Awesome. I'm dumbfounded. That's a lot of information that Doc has given us. That's a lot of information. And well, it is a lot of information. I'm learning a lot on this show. Seriously, it's a lot of information that you can't find anywhere. This is free advice that you cannot find anywhere. So we really, really appreciate you. Okay, so we're gonna just go straight to the questions that we have. Viewers, if you have any questions, please send your questions, send your comments right in the comment section. Just type it and I'll see it and then we'll read it out. If you have any questions, you have anything bothering you about colon cancer, if you haven't done any of such tests, please go ahead and do it. If you are, especially as they've told us, if you're above the age of 45, please, if you haven't done any form of colorectal screening, please go ahead and do it ASAP. All right. Okay. So, Doc, why is colorectal cancer sometimes called the silent killer?
I will come in. Thank you so much, Ms. Del. So when they say colorectal cancer is a silent killer, they use that phrase because of how slow it develops. You know, it takes at least 7 to 10 years or even longer for a small polyp to grow and potentially become cancerous. So many times, some of these polyps, they can be small, sometimes they can be benign. But because of the longer it takes, then it can turn into other form of cancer. So we have the type which is the hyperplastic, serrated, and the adenoma cancer. And as Dr. Owusu initially said, these can be a factor related to family history, which is a genetics. Also, as she did mention earlier, lifestyle, which can be increased, our diet, increased red meat intake, smoking is another issue, increased alcohol intake, and obesity. So lifestyle changes, exercising. You can eat meat, but you have to limit the intake of the meat. We can substitute the meat with, fish. Sometimes we even have our homemade dry fish we use for soup. It's very healthy. Low fat diet is another thing. Also, inflammatory bowel disease, another thing too, that can also make a person be exposed or be a potential risk for having this colon cancer. So that is why they say it's a slow, a silent killer, because of how it starts, and it does not show any signs or symptoms until it's in the later stage of its development. Yes.
Wow. It is indeed a silent killer then.
Yes.
So how long does it take for the polyps to grow in the colon?
I can take that.
Okay.
Okay. I'll say that it's within 10 to 15 years, averagely. I would like Dr. Mensah to add more.
Okay.
Sure. Thank you, Dr. Wusu. So as Dr. Wusu said, 15 to 20 years. And as I initially said, they grow slowly. And often, as I said, there are no symptoms. So regular screening is the gold standard, as Dr. Wusu initially said, especially with the colonoscopy, which is the gold standard. And also screening can also detect and remove polyps earlier before it become more cancerous. So that is another thing. Yes. And recently too, there was a research that came out about 2 months ago where they can also use, blood work. It's another thing that they are starting to do, but it's just new in the diagnostic stage.
Oh, okay.
Yes.
And can the polyps also, can they grow back when they're removed?
Can they grow back? Yes, it can, if still again, lifestyle is the main thing. If we are engaging in poor lifestyle, alcohol, increased fat intake, red meat, obesity, and also the main thing is family history is another thing. So then again, regular checkups, lifestyle changes is the key. Yes.
Okay. Okay, good. All right. So let me go to the comment section. I see some of our viewers have sent some comments here. Irene, hello, Auntie Irene. She says hello to you all. And we have Victor Doe also says, thank you very much for bringing this knowledge to our homes. Akpe Yedamwase. All right. Thank you all for your comments. If you have any questions, please bring it. Any comments, please go ahead and put them in the comment section. So, I know Dr. Dacia has already said that the colonoscopy does not hurt at all. It does not hurt. It's just the pressure that you're going to feel. No one is done. So it does not hurt. So please, let's go ahead and get that screening done. So are there any easier or less invasive screening options other than the colonoscopy itself?
Okay. So for the screening, I think I mentioned that when they use the occult testing one, that one is just less invasive. You just poop, you take a little into a container, you follow the instructions, and you take it back to them for them to do laboratory investigation. That is one. And the scan ones, the CT scans and the MRIs and all those ones too, they are not actually invasive. The most invasive is the colonoscopy, but it comes with no pain. I hope my answer is clear.
Okay, yes. Okay, so we're talking about screening and screening. We don't want you to go to the hospital or you go to the doctor's office. It's quite expensive. Healthcare is expensive everywhere. So what if somebody doesn't have insurance? Are there any other ways, they can go get the screening done?
Yes. I would take that. You need to mute. So you can go to your state community clinic. They offer all these screenings for free, but the best place to go is we have so many community clinics in all the states. So you go there and then you inquire. If you have a high risk, if you are among the high risk population, just like Dr. Dosia said, if your family member has been diagnosed with colon cancer before, or if you have the factors that contribute to you being a higher risk, you will be a priority on their list, and they will guide you where to get it screening. So yes, your community, your state clinic, they offer them, but you need to go to them to inquire. Thank you.
Okay, awesome. Thank you. Okay. And earlier on, I know Dr. Dosia, you talked about the signs, some of the signs about the pencil-like poop. And are there any other signs that we should look out for?
I can take that.
Okay.
Yeah. So as Dr. Dosia earlier said, the signs mostly coming from the stool. Mm-hmm. Sometimes too, you might have abdominal pain. Sometimes you have like abdominal bloating. No matter what you do, your abdomen is kind of a little bit enlarged. So there's something that your baseline. Out of the blue, you see that you have had consistent abdominal bloating, which is out of your baseline. You need to follow up with your outpatient provider. And as Dr. Upon said, even if you don't have insurance, they have community resources that you can seek help from there, where they can help you to rule out any, organic issues, which is related to GI problems. So that's one thing that you have to follow up. Abdominal pain, easily you get full, even with little eating, you get full easily. Difficulty emptying your bowel, or even after emptying your bowel, you still feel like you want to go. These are the kind of symptoms that you want to follow up.
Okay. Awesome. Thank you. So, we've been talking, we said when you're 45 and above, we have to go for the screening. Can young people also get colorectal cancer?
Yes. I'm sorry. Yes. I feel like recently I've seen that even young people are coming out with being diagnosed with other forms of cancer. Recently, I had a 30-year-old or a 24-year-old had a breast cancer and who passed away maybe a month or 2 months ago. And I feel like the community that we're coming from, or gone are the days where a person might be maybe in their 70s, 80s, that's when they get diagnosed with such, cancerous diagnosis. But now young people are being diagnosed. So there is a chance because of, the kind of food that is coming in the system, the engineered food, a lot of chemicals in the food. So it is exposing everybody being at risk for this cancer. We have families who have no family history of cancer, but you see somebody pop out of the family as young as maybe in their 30s and they've been diagnosed of cancer. So it's coming from the food that is being produced massively into the society. Yes.
Wow. Thank you so much. It has been a very educative and informative section. I've learned a lot personally, and I know our viewers have also learned a lot. They have learned a lot. We have to not take our screenings for granted. No, not just for colorectal cancer. On this show, we'll be anybody who comes here always tells us when it's time for your yearly reviews, please go do your screenings, go do your checkups. Don't let us take anything for granted because our health is our wealth. If we go day in and day out, we wake up, we're going to work, we are running after the money, and then you come back home and then you're sick, you don't have good health. How are we going to enjoy that money? And there are a lot of people back home who are depending on us. So please, let's try to stay healthy so we can enjoy the fruits of our labor and also help our community. Thank you so much, ladies. I can't emphasize on that enough. I'm so grateful. We are grateful to you for coming on this show this morning. We know you're a healthcare professionals and you're very busy, but you've taken time to come educate us.
Thank you.
We are very grateful. Viewers, all too soon, our time is up. Yes, the time is up. When we're having fun and learning, the time is up. And so please, as I said earlier on, continue to share the link. Just go to YouTube, go subscribe. It's something that anybody can watch anytime, and everywhere in the world. Please, let's not just limit ourselves to maybe Ghana or the US. No, anybody can watch and also learn from it. And we'll keep educating ourselves, to stay in good health so we can enjoy the good life and wealth that God has given unto us. Thank you again, ladies. Until we come your way again next Saturday, viewers, it's been a very informative and educative session. And my name is Binsdale. And remember, your health is your wealth. Be strong and stay blessed. See you later. Bye-bye.
Thank you. Thank you for having us. It's a pleasure.
Okay, bye.